Our presentation is retinitis pigmentosa. My name is Kiera Grace.
And my name is Kayla Chin.
Retinitis pigmentosa is a group of rare genetic disorders that affect the eye. Retinitis pigmentosa can be inherited from a autosomal dominant, autosomal recessive, or X-linked inheritance. Autosomal dominant inheritance is when only one parent has to have the gene for it to be passed down to the child. And this can be seen in the diagram right here. And there's a 50% chance for the child to actually have the disorder in this case. And autosomal recessive disorders, both parents have to have the disorder or carry it in order to pass it down to the child. This is only a 25% chance for the child to have it, and this is shown in the presentation right here. An X-linked recessive disorder of retinitis pigmentosa, the boy generally has it because the child only has one X chromosome, while females have two X chromosomes that they can depend on. If a female has it, they have it to lessen severity of a male. And the abnormal genes that are created from this create deviant proteins which are found within the photoreceptors.
These photoreceptors are cells that make up the retina. And the retina is a light-sensitive tissue that lines the back of the eye. And so the photoreceptors slowly deteriorate and die. The job of the photoreceptor cells are to send electrical impulses through the optic nerve to the brain. When this happens, the brain helps us create the images that we see. When we see light rays pass through our eyes, through the cornea and the lens, that's where the focusing power comes through. The 70% of the focusing power comes from the cornea and 30% comes from the lens. And this affects how the cells function when the light rays hit the retina. This is why the retinitis pigmentosa is a gradual process and is not stopped.
Okay.
This would lead to the signs and symptoms of having night or dim light visual impairment, loss of peripheral vision, swelling of the retina, problems with vision color, and bone spicules.
Okay, retinitis pigmentosa is diagnosed through genetic testing in which tissue or a blood sample is taken from the affected area and tested for the genes associated with a certain disorder such as retinitis pigmentosa. Also, it is also diagnosed from electroretinography, in which the retina is tested for its response to light and also its electrical activity.
And the treatments for this disease could be gene therapy, which is used in research for curing retinitis pigmentosa, and the scientists are attempting to find a way to place healthy genes into the retina in order to replace the sickened genes. Another way is to use vitamin A. It has been shown to slow down the process of retinitis pigmentosa, although its effects isn't very strong. Taking too much can be toxic for the body. And the other treatment could be the Argus implant. The Argus implant is a artificial retina that can be surgically implanted into the back of the eye to help take away some of the signs and symptoms that retinitis pigmentosa gives the patient.
In the entire world, 1 out of 3,000 to 4,000 people have retinitis pigmentosa.
And so let's go on to the patient's and family's perspective. So the patient's diagnosis, she was diagnosed at age 3, and because of by her pediatric ophthalmologist, and she was diagnosed because her parents noticed that she was running into objects. So in the examination, she was spotted with a black spot in the back of her eye, which was a bone spicule. A bone spicule is a black spot in placement of where original photoreceptor cells have died. And this happens in the retinal pigment epithelium.
Currently, the child has glasses that she uses, although she says they're very, very effective, and she tries not to use them. In class, she sits in the front so that she can engage in activities as she has vision loss, while in extracurricular activities, she doesn't need any visual aids, and she can participate in her ballet and tap without these things. At home, she has night lights to help her guide through her home because she has dim light impairment.
And some of the signs and symptoms that she personally has is a visual impairment in dark and dim lighting, and she has loss of her peripheral vision. So based off of our patient, we move on to our product for quality of life, to improve quality of life. And we based it off of how our patient had trouble working in the dark or dim lighting. So our glasses have sensitive lights that won't emit blue light to strain the eyes. This will come with a charger so that there will be no batteries included to make the appearance look bulky. There will, and in that picture, this is a type of light that we would want to use, a light that does not include any blue light. So you have a light bulb with blue light and the next one with no blue light. And there would be a controls on the inside of the glasses to help manually adjust the lighting to what the patient prefers. This will help with evening tasks when working in the dark.
Dr. Jin, which is our doctor that we visited and talked to over the phone about retinitis pigmentosa, reports that in the past she has researched and treated patients with retinitis pigmentosa, but currently she is not invested or produces any work or research for it. She says that out of the thousands of people who enter Nemours, only less than 100 of people are there with retinitis pigmentosa, and that retinitis pigmentosa can be with other diseases and disorders such as Usher syndrome, although this is very unlikely. And as a result, they can have systemic problems such as vision loss, as well as losses of hearing. And she says in the cases of patients with X-linked retinitis pigmentosa that they are generally males.
Okay, and what Dr. J reports is that the treatments and accommodations such as white keens, brailles, seeing eye dogs, and gene therapy will help improve the patient's quality of life. She also reports that most ophthalmologists don't suggest high doses of vitamin A because they are not convinced of their efficiency.
So we are both sophomores, and we are both enrolled in the Allied Health pathway. Currently, I am invested in becoming a general practitioner, but this experience has really helped me learn more about the eye and disorders of the eye.
Well, me on the other hand, I have my eye set in a career in optometry. I've had an amazing time experiencing the entire project of researching retinitis pigmentosa, and this has really opened our eyes into doing more things like this.
The most interesting part was looking into the patient's life and how it truly affects a person as a whole and their family.
So, after our presentation, we would like to thank Nemours, our HOSA advisor, the patient and the patient's family, and Dr. Jing Jin, and for having this event brought to us.